I couldn't remember if it was my Zoom or your Zoom. So,
Aha, there we go.
hello everyone, and welcome. My name is Lucy Henry, and I'm going to let Ben kind of do his intro, and then I'll come back to you. So,
Well, hello, I'm Ben Bullock with Together SC, and we're recording this because we want to make sure that other folks, as they come into the EAP program as well, they have this as a video they can watch to learn more about the program and how to access it. Um, so, earlier in the year, in about December, Together SC established a relationship with First Sun EAP in order to offer their benefits and services to our members at a very affordable price. And we thought it was a great complement to our association health plan, as well as some other member benefit plans that we've been coming up with over the course of the last year. And what we've learned is that with the EAP, accessing its benefits is really quite simple. There's a flyer and a phone number and website and you can go to and access the benefits that way. But folks, a lot of folks just don't know that it's really that easy. So we've scheduled this call to do a walkthrough of the process so that you know how, and you can go and tell the rest of your staff and your employees how to access this benefit now that you've enrolled in it. So, Lucy, thank you so much for taking the time to walk us through the process today.
good. Thank you, and thank you for allowing me to be here. So, as I said, my name is Lucy Henry. My title, which could change tomorrow, is Vice President of Stakeholder Relations, which basically means that I am kind of the benefit and sales person, but I'm also now the kind of go-to person for Together SC. So it will kind of come into kind of my purview. Maria Lund, who was working real closely with Ben and the Together SC folks, is, well, officially retiring Friday, but unofficially, she is basically took 2 weeks of vacation, so she's really already gone. So we're all adjusting to change, as Maria has been our president and COO for 18 years. I have been a part of First Sun for actually next week 23 years, and came into First Sun as, even before that, as a clinical provider, but then came to work for First Sun full time in April of 2000. And I have a love for EAP, and I have a love for nonprofits. So actually, my first EAP job was with the Spartanburg Alcohol and Drug Abuse Commission, so a not-for-profit agency that we were able to to provide alcohol and drug services, but also EAP. So I cut my teeth on kind of learning EAP that way. But my background is also in ministry and hospital chaplaincy. So as I say, it kind of really, my road travel kind of got me to where I am today. I never thought I'd be doing sales, but I like to talk. So, and I love people. So that's my big thing. So thank you for the work that you do. And we are just really, really pleased and excited about being able to provide this product for you and your employees, really at a cost that's affordable to your agencies. And so that we can do that, and that your folks can have access to the resources of an employee assistance program. So I want to briefly kind of do an overview of EAP, because people always have different ideas about what an employee assistance program is. And my guess is you've probably worked at other organizations or workplaces that have had some kind of an employee assistance program. And we like to say, in the world of EAP, you've seen one EAP, you've seen exactly one EAP, because every EAP is different. But First Sun EAP is a South Carolina-based small business. I love saying that to begin with. We're a South Carolina-based small business with our headquarters, but it's really headquarters in name only, with in Columbia, because we have an office that's basically a storage space. But we had actually all gone remote, except for like 3 people in July of 2019. So in March 2020 hit, those last 3 people had to go home, and our office since then has just been kind of storage. So we would get together for meetings once a month. We're just now doing all Zoom and team stuff, and we get together twice a year. But First Sun was founded really by Don Lake, who had a heart for helping people. And our mission is, we help people be better at work. But the heart of First Sun EAP is really about getting folks having access to the resources they need to be their very best selves. So what we say is that EAP stands for Everyone at Potential. And that starts with your work organization first. Really that work organization being healthy, being the best it can be, so that your employees can be the best that they can be. Because my guess is you probably all worked in or are familiar with a toxic work environment. And if the EAP in some way through our consultation or training or just working alongside us can really help your work organization be healthier, then we want to do that. And I know that Together SC is offering a lot of different ways to do that as well. So we start with that work organization. And then we really look at the leaders and those folks and really trying to help you understand how the EAP can benefit everyone. And then, of course, we drop down to the employee and family member level. And so we are covering through this product basically all of your employees, regardless of whether they're on the health plan or not. So whether you've got 1 or 3 or 5 or 50, we are covering all of those employees as well as their household family members. And when we say household family members, we're really talking about, okay, who's living in your home? Well, what if your mother-in-law or father-in-law or sister or whatever has moved in and they're having a hard time? That is probably impacting you at work. And we come back to the workplace because an EAP is really about the workplace and helping people be better at work, but also in life. So if something is going on within a home, within a family system, and it's impacting somebody at work, then we want to get to the heart of the problem and help that person. So, that's why we say household family member, because not everybody that's living in your home is necessarily going to be blood related. It may be, a partner, fiance, might be, again, another family member that's living with you. Now, your second cousin's girlfriend's son has moved in. We might have to look at that, but, we'll look at eligibility and how it goes. But again, it comes back down to whatever's going on with that person and how it's impacting the employee. And then we also say we're covering, those family members, just like insurance would, even if they're not living in the home, up to age 26. Because if you've got a child that's not, away at college or has moved out, maybe is married, but they're 23 and they're struggling, we want to be able to provide services to them. So that's kind of where eligibility comes in. Now, when it comes to services, we are providing counseling services of 3. So it's considered short-term counseling. So it's not, counseling that you're going to think about, okay, I want to go see a counselor and I may be seeing him for the next 10 years. It's really about kind of short-term problem-focused counseling. But if someone really needs more than 3 sessions, then we try to get them with somebody that's going to be able to work within their health plan in that manner. But again, that's 3 sessions per contract year. Now, the way we're kind of running the contract is that right now we've kind of got a short contract that we're doing. And I think in July, and Ben, you might have to correct me because I don't know that I'm right on this, but in July, we'll start the year over. So then we'll go July to June as the year. So anybody that's come on now will renew in July.
That's correct.
That's how that's working. Good. Okay. So yeah, so let's say you come in now and you get 3 sessions, but you really are looking for more 3 sessions later, then or in July 1, we can open that up for 3 more sessions. So that's the counseling end of that. And when we talk about counseling, it's really basically anything that you might want to see a counselor for. And this can be either, again, in person, face to face with a counselor in your local area, provided we can find somebody who has an appointment available, because that's the crisis we're in now. Is mental health clinicians are full, but getting people in. But we do have a lot of folks in our network that have openings, and they've promised us they'll get folks in. So face to face, that's what most people think about. But also, we have a lot of counselors in our network that use a video counseling modules and are doing only telehealth now. Kind of COVID started that, and they realized, I kind of like this. I don't necessarily need to have an office, be paying this overhead for this office. So they can do that. But then we also partner with a group called BetterHelp. And I'm sure you've probably seen the commercials either on social media or in podcasts or on TV. They are a large telehealth counseling platform that we have a deal with. And they have counselors across the country that can do, again, video, but also telephonic and kind of message-based, either text or asynchronous messaging, where somebody might send a message and then, 3 hours later, the counselor messages back. So that is the way that works from a counseling perspective. Again, for just about every situation. Now, a lot of people say, well, I have a family member or I have an employee with a substance use issue, and that I think they really need to go into treatment. First Sun EAP does not pay for treatment, nor do we pay for somebody to see a psychiatrist. So these counselors are licensed master's level clinicians, sometimes PhDs, but not MDs. Psychiatrists are medical doctors or nurse practitioners that would go through the medical plan. So that is the way that's going. Kendall, if somebody's already seeing a therapist, you can always find out if that therapist is in our network or if they're willing to be in our network. So we're always willing to add therapists if they're willing to work within our parameters, what we pay, kind of our billing parameters, those kind of things. So you can call and say, you can always call me to say, hey, is such and such in your network? Then you can have those 3 sessions, especially if you have a high deductible plan and you're trying to kind of get that down. It's a way to not have to pay for counseling sessions. Did that answer your question? Okay. So that's kind of the counseling piece of that. And, what I need to go back and say is I really need to highlight the importance of confidentiality. A lot of people say, I'm not going to use my EAP because it's tied to work, and I don't want work knowing anything that's going on with me. Well, that is a fallacy because EAP is confidential to the highest extent of the law. So from, if we had to report anything to anybody, it would be if somebody is threatening to hurt themselves or somebody else. There is evidence of child abuse or elder abuse. If there is a subpoena or court order for records, or if somebody is in a protected kind of work situation where they are engaging in behavior that could put other people's lives at risk. Sometimes by law, we have to report that. So if anybody knows that somebody else is using the EAP, it's because they've told them. And we know how that goes. Somebody tells somebody who tells somebody else who tells somebody else. Or, that's kind of, but we really do strive to uphold confidentiality. It's in our ethics, but it's also about HIPAA. So nobody's going to know that somebody's using the EAP. So that's kind of where the counseling again comes in. Now, if there's a workplace situation, and we can get into formal workplace referrals maybe in another webinar, because again, this is a way to use EAP as a workplace tool. But there will have to be a signed release of information. So to know that. So you got counseling. And then you have what we call life management services. The life management services are, again, resources to help people And it's really, again, just ways to help people reduce the time and effort it might take to deal with some kind of a life issue. So those life management services, and I'll kind of highlight them quickly, and then I'm going to show you our website and show you where you can read more about those. But the life management services, we start with financial. One of the things that we know is that financial stress is the #1 stressor of employees in the workplace. And there you see lots of stuff about financial wellness. So First Sun EAP has several partners that we work with to provide services to our clients or members and their family members. The first being a group that will do financial coaching. Somebody is really working on debt management. They really want to reduce their debt, and they need some coaching that way. So that's coaching around anything that's financial. How do I save for retirement? How do I get out of debt? How do I set up a budget? So coaching and online resources. Then we have a group of financial planners who are totally unbiased that can really help with financial planning, estate documents, those kind of things, as somebody might need from a financial, not estate legally, but really kind of working on saving for retirement. You need to put money in a Roth or a different kind of a investment that, again, they're not going to tell you where to put your money, but they are going to advise, maybe this at your age, you might want to look at this. But they're also totally unbiased. They're not going to try to sell you their services. And they can also help connect with, the state retirement plan or whatever it is you might be working with if you need to do that. And then our third financial resource is a provider that we have contracted with out of Bluffton. And he's a financial planner, but he's really passionate about the Dave Ramsey model and helping people learn and establish and work within that kind of Dave Ramsey model of financial well-being. So that is that part of financial. And again, there's 3 sessions that somebody might use or 3 referrals, but again, that are separate from the counseling referrals. So from a financial standpoint, and then from a legal standpoint, we also know that one of the major stressors is somebody who's got a legal crisis, a legal issue, is that folks can be referred to an attorney within our legal partners network at for an up to 30-minute legal consultation. You just got some questions. You're trying to figure out, I need to get these legal documents, or I'm trying to get custody of my child, or I need to get filed for divorce. And I don't have a clue what attorney to use. So a referral to an attorney that way. But also, folks need to have legal documents done, referrals. And that is at anytime somebody wants to retain an attorney, they are promised to have a discount of up to 25% from that attorney's customary charges. So, and then aside from that, on our website, which I'll show you, we have legal forms that folks can go. If you need a simple will or a healthcare power of attorney or living will or other kind of simple documents, there are forms through NOLO legal forms that you can go do at no charge. Now, if you just go to NOLO legal forms, you're going to have to pay for it. So this is something that the EAP is providing to you, as well as, employees, as well as their household family members. And again, there's really no limit as to who can do it. So you need a will for your father-in-law, he can actually go on there and do it. So that's kind of how it is, and I'll show you how to get there in just a minute. Elder care. I don't know if you're like me, but if you have an older adult in your life that you may be concerned, they're really at the point where they can't be at home, or you need extra care, referrals for older adult services. It might be home care. It might be looking for an assisted living. So let's say, and this is something that I actually did, is that I called and said, okay, I want to move my mom to Greenville. What are some assisted livings that I can go look at? And they got me a list of about 6 assisted livings that I then made contact with and went and visited to see if I like that. But let's say you're really just trying to understand the difference of what's Medicare going to pay for, what's Medicaid going to pay for. I have to get Medicaid for my loved one, or they have to apply for Medicaid, what are all the ins and outs of all that? Educating myself, because that's complicated. Or what are my Medicare skilled nursing days? So to really kind of understand those kinds of things is where the elder care referral stuff comes in. And the same with that is it's child care referral, looking for child care centers, after school care, summer camps, tutors, nannies, any of those kind of things. Again, they're going to help with finding those resources. Again, they're not going to pay for those things, but they can at least get you connected to where the resources are. The same for college assistants and school assistants. If you have a child that's getting prepared to go off to college and you're trying to really understand what is this whole process of, trying to find the right school for my child, or if you want to go back to school, what are some options? How do I fill out a FAFSA form? What am I going to need? Do I qualify for any kind of financial aid for students? So to understand that, as far as school assistants, looking at maybe tutors, if there's a special needs child, and really trying to find resources for a special needs child, they're going to have resources there. And then even pet care. So you have, a four-legged that your family wants to adopt, or you're looking for an obedience class, or you're looking for a vet, or a kennel, or a daycare type situation, and you want to know where those resources are, those referrals can be made. And then there's things like just life services, looking at, enhancing your own job, trying to get a plane ticket, get a concert ticket, so kind of concierge type things. So there's no end to what the life management services can be. And again, you have 3 of those per contract year. That contract year, again, like I said, we're going to run to July and then start over July 1. But let's say you're looking for, you've got mother-in-law has moved in, but you're looking for some extra care for them. So you're wanting to kind of look at some older adult services, but you're also maybe looking at some financial and some legal services. So that would be 3 referrals for you and how that goes. So any questions about that? See if I missed anything from a chat standpoint. Don't look like it. All right, so what I want to do now is I'm going to actually share my screen and take you to the First Sun EAP website and be able to show you some things. And I'm probably going to ask Ben some questions because I'm still trying to clarify exactly who's doing what things. So see if y'all can see this. Can y'all see that?
Almost. There we go.
Okay, good. Takes a minute. All right. So this is the First Sun EAP website. FirstSunEAP.com. It's that simple. And kind of our, opening homepage really just kind of tells you where things are. But if you were to go to My EAP, you're going to see things on just kind of how to use your EAP, counseling services. But the life management services are detailed here, so that people can really, go in and really understand what things are. So the financial, the legal, elder and adult, childcare, education, adoption, which I forgot to mention, then other kind of home and life and work and career, and then even health and well-being, and of course, pet care. So how does somebody access the EAP? Well, the first thing that you need to do is know that there's nothing people have to sign up for. It's an automatic by your work organization actually signing up with Together SC. So it's automatic. No, we don't take names of who your employees are. They don't have to register for anything. It's just automatic from the very first day of hire but we basically say 90 days post separation. So something were to happen and somebody were to leave employment to go somewhere else, or they were to be laid off, they would have 90 days that they could still use their EAP services. So in order to use services, you can do one of 2 things. You can call this 800 number, if y'all can see it, 800-968-8143. which gets you to our main phone line. And it's got a very short kind of chain, which basically says to access your services, press 1. That will get you to an intake specialist. We have 4, well, I would like to say we have 4 intake specialists. Right now we have 2 plus whoever else is helping out. One's out on maternity leave and we're getting ready to hire our 4th. But an intake specialist is going to gather information, name, demographics, but really what they're doing is seeking to find out what somebody is seeking help for and to really understand what's going on. So let's say that Amy Smith calls. Amy Smith lives in Greenville, and she calls and she says, I'm calling because my company has EAP through Together SC. And this is something that y'all need to remember, is that even though folks want to say, I work for Horry County First Steps, they really need to be able to say the EAP is through Together SC. And by doing that, we're able to find them. So because it's what we call a consortium model. So everything, all of your individual work organizations fall under Together SC. So Amy Smith calls. Amy's in Greenville. She says, I want to access my EAP, and I think I really want to see a counselor because I'm dealing with anxiety. And so the intake specialist is going to say, tell me a little more about that, Amy. Or is it impacting you at work? Have you missed any time from work? It's what else is it impacting? Have you ever sought treatment for anxiety before? And they're also going to say, Amy, do you actually know a counselor that you would like to see? And she says, no, don't know anybody. Do you want to see somebody close to home or close to work? Do you have any kind of preference? So she says, well, I live kind of over in the east side of Greenville. This is my zip code. And I think I really want to see somebody who identifies as a Christian counselor. So our intake specialist is going to say, okay, I think I know exactly who the right person is for you. And here is their contact information. I will make an authorization for you to have 3 sessions with them. So the intake specialist gives the name of the clinician and sends that authorization for 3 sessions. Amy then calls that counselor and sets up counseling. And then the counselor bills First Sun EAP for those 3 sessions. So it's no charge to Amy, but if Amy wants to continue through her Blue Cross insurance plan, then the counselor will be billing through the Blue Cross plan, and they would be responsible for any deductible or copay that they might have. So it's pretty simple that way. But let's say Amy says, well, I want to see a counselor because I'm dealing with anxiety, but I also really think I need some financial. I'm really dealing with a lot of financial stuff. So then that referral is also made either by a warm transfer to our financial vendor, or we say, okay, we're going to have the financial vendor call you at a time that is, convenient for you. So that's how that happens. So it's, a little bit of work on the client's or the member's part by having to follow up with the counselor rather than our making that appointment, because it also, that's the buy-in. One of the things that we have found is that when you don't have to pay for something, there's not as much buy-in, but if you've got to do a little bit of work, then you're a little more invested in it, and it's investment in your well-being. But the other way to access services is by using, come into the website, and if you saw under my EAP, here is that request my benefit. If somebody clicks request my benefit, it goes to a form that I'm hoping will open. Can y'all see that? I never know what people can see on there.
Yes.
So basically, it's a way to fill out a form. And again, it is a HIPAA compliant form, which basically asks all the questions that an intake specialist is going to ask. And it says you can leave a voicemail, I want a return call, or I want a secure email. So a lot of people are choosing to use this form, because they're in a work environment where they really can't talk. or it's just easy to go online and do it, or because, you know, they're really struggling with what they have going on. And I actually just talked to somebody who said this and said, you know, this form was a lifesaver for me because I couldn't even talk about what I had going on. I was grieving so much that I didn't want to talk about it. So I could go in and fill out this form and everything just came to me securely and I was able to take care of it. So some people just don't really want to talk about what they have going on. So we're doing it this way. You know, our hope is that in the very near future, we're going to even have some chat features through a secure website where folks can actually say, well, I want this, and it can be done that way. We're not there yet. Technology, it's A, the technology that's affordable, but B, it's also having the staff that's competent enough to be able to do it and can manage doing that. But that's kind of the way that works. So I want to go back to this my EAP place. There we go. Takes a minute. So where it says my EAP, so you walk through kind of how to use life management. We have two newsletters, the employee and family, which comes out every month. That employee and family newsletter is always tied to a theme. And when I go to our well-being site in a minute, I'm going to show you how those themes work together because they have a theme as well. So that newsletter really enhances the webinar that they. And then we also have a leadership newsletter that is written by First Sun staff that we that are really dealing with workplace issues. So the HR and leadership really talks about and I lost it, talks about our training and development. It talks about just resources for HR, but also here there are ways to actually go and pull posters and newsletters that are available for you to print out or pass along to your employees. So we have a number of materials that are, you know, a way to be able to tell your employees what we have going on. From a workplace referral to trainings to any number of things. And we're, again, this website is getting ready to change. But then there's posters, and you can print these posters out, or if you have a screen, many of these are actually slides. So if you wanted to slide a slide, so, you know, whether it's just on beating burnout or budgeting, you can print these out yourself or pull the slide, put it up and share it with your employees. So all sorts of things, topics that are here, and I won't go through all of them, but that is a way to kind of see where that is, but also for you to sign up for those newsletters as either an employee or a leader, and to have your employees sign up for that. So that's the big part of this. Now, the other thing that I want you to see is where it says well-being and training login. And this is what we call our web portal. And everybody who uses this needs to use it, needs to register. And I'm not going to register right now, but if you click register, it's going to ask for a username and it's going to ask for a company name. And the company name again is Together SC. But then this gets you, I'm hoping this will work. No, okay, because this will work. We keep changing our admin password. All right, I'm going to show you how to register because I'll have to do it this way. So I'm going to put in and company name, and it's if I start putting in something, it's going to pop up Together SC. Then I create a password. And of course, it wants, all those things that other registration sites want. Passwords don't match. Of course they don't. I can't remember them. Oh, don't do that.
I was gonna say you may want to stop sharing for a moment while you
Yeah,
work on
no,
that.
I'm not. I was gonna suggest, I hit the wrong button. Yes, wrong password. Okay, there we
Yeah,
go.
that's what I always do.
Yeah. 'Cause
Because
it says,
I can't remember the passwords I
well, I
come up
know,
with my
I think
own
that's
brain.
one of the hugest stressor that anybody has, is remembering passwords. Okay, so here we are. So like I said, every month there is a theme, but there's also typically a news alert. So like there's a news alert here for the tornadoes that hit Mississippi and Alabama last week. And there's even, just resources for that. We've had floods, shootings, any of those kind of things that they put resources up. But every month there's a theme. So this month is caring for the caregiver. There is a webinar that can be watched at anybody's time frame. So it's not necessarily live, but then there's tip sheets and other resources that are there. Also here are video manager and employee orientations. So you can actually appoint your employees to this, and they can actually go through, and everything that I talked about is actually on a recorded version from somebody who did that with slides. I just don't like the slides, so I just kind of talked you through it. Again, there's also the things that we have going on. And then there's resource centers. Now, what you need to know is that this site is going to look very different within the next 2 or 3 months. There's actually going to be more modules and more ways to really be able to help people. But there's topics. So if let's say there's a relationship topic and you're looking for something again on caregiving or nurturing yourself, there might be a soft skill that's there, a soft skill training. It might be a video. It might be just some tip sheets on how to nurture yourself. Same for emotional well-being. So that's what's there. But this is where it says webinars. There's the webinar that's going on this month. So March is caring for the caregiver. Every month there's a new webinar, but then they archive all the webinars. So there's just a ton of webinars that are here. There's also a training center where people can build skills for, again, personal or professional use and go and do, a online training, again, at no charge, and print out a certificate. So if you've got some kind of training requirements for your employees, or you want to say, I think you need to go do a training on communication and bring me back their certificate, there it is. But here is where all the legal forms are. And again, there are interactive legal forms as well as downloadable. So for whatever legal form you want, you can pretty much find it here by searching. And I tell people, go to the downloadable. If there's a form you want, go fill it out and then go back to the interactive. It's like using TurboTax, where you actually it asks questions and you fill it in. You print it out and it gives you instructions of whether it needs to be notarized, signed, or filed. So those instructions are there for those interactive forms. Again, you don't have $600 to go pay an attorney for a simple will, but you need a simple will or you need a healthcare power of attorney. This is the place to go. And you can also search. And then there's financial articles. There's financial calculators. There are assessments. There's just if say somebody's saying, do I have anxiety? They can go in here and actually do a general anxiety disorder assessment. Our newsletters are here. There's help videos. there's recipes, you name it, you're going to find it on this website if you really want to do some personal growth. Every person needs their individual login because, you know, again, you might want to save something. You might be starting a course and you can't finish it. So you want to come back to it. So everybody needs their individual login. You just need to remember that it's going to be under Together SC. All right, I'm gonna stop talking and see what questions you have. Because I've gone through a lot of information, and I hope that you'll go back and really look at the website and in the well-being portal and be able to tell your employees and your family members about what the resources are that are available to you.
Thank you, Lucy, for all that. You're right, it is a wealth of resources that are available. I just signed in myself. And I didn't realize, I forgot that folks need to use Together SC as their employer for this purpose. So thank you for reminding me about that, and I'll make sure that in our communications with folks, I put that in bold letters. But a whole massive wealth of resources for employee wellness in there as well. And I encourage you all also to watch the get into that website, and then watch the manager orientation video, as well as the employee orientation video. And Amy is asking who should she contact to get her help with her username and password. She's created an account, can't remember the password.
I'm gonna tell her.
Hmm?
I'm gonna have her send me an email.
Okay. Well, there you go. So if you get locked out and the password reset function is not working, contact Lucy or another person at First Sun. Any other questions from folks?
Did anybody else have any questions? So y'all got my email here. I'm gonna give you my cell phone number as well. Would love for you to contact me, reach out to me if you've got any questions, or if I can help with anything, you know, please let me know. I am in Greenville, and I am, you know, available. I'm in and out, and I'm here, there, and everywhere, but I will get back to you as soon as I can. And you can always text me at that number. Just tell me who you are, you know, to be able to say that. You know, again, I want to be available to you to ask questions, just to really to know what, you know, whatever your needs are. So I know there's a handful of you people here today that are here. There's a whole lot more that need to know this. And I know that there are probably a lot of other Together SC members that haven't taken advantage of the EAP. I met somebody yesterday who was asking about EAP, and I said, "Are you a Together SC member?" She said, "Yes." I said, "Go talk to Ben." That's the way to do it. And then I talked to somebody else who was not a member, but I'm like, y'all should be, and this is a way to get EAP. So, you know, make sure you talk to your colleagues, other nonprofit folks, because again, you know, you might have EAP through your insurance or through another way, because we work with Blue Choice. And so if anybody's under a Blue Choice small group plan, or we actually work with some PEOs that have EAP through the PEOs. So you can have a double benefit even. And it's worth it. So it's a good way to know that. But please reach out to me. You know, I want to be available to you as best I can.
I did have a question, and I apologize sincerely for being late. I had another meeting that ran over, so I'm very sorry if you've already covered this, but I just wanted to clarify the amount of sessions and stuff like that is covered? And I know you said there's 3 per contract year for the life management services. Is that the same for counseling? Or is there a differentiate? Do you get 3 of each, or is it 3 total?
So it's
Those
3
kinds
of each. So it's 3 counseling and 3 life management, and that is per employee as well as their household family members.
Okay.
Mhm.
Per person.
Yeah.
Then. Okay. Okay.
And I know that Maria and I talked about in the next year, after July, that we may offer an expanded version with 6 sessions instead of 3, and make that an option for members to select whether they wanted the 3-session or the 6-session version.
Okay, and I know you said it, for counseling, there might be authorization for 3 sessions at no charge. So those are beyond the 3 calls with.
Well, no, that's the way, because what we do is we authorize. So a lot of people that may be used to kind of another kind of EAP is they think of it as calls. So, you can have unlimited calls to the EAP.
Okay,
So authorizations are really done for referrals. So whether it's seeing a counselor in person or through video, but it's typically a referral outside of First Sun EAP. So our model is what we kind of call a provider-based model. So we're actually working with clinicians, that are local to the area, or online folks that are, licensed where that person might need to be.
okay, thank you. That helps.
All right. Any other questions? If not, thank you all for your time and attention today. And as I said at the beginning, we're recording this, so we'll make sure that we get this posted and sent out to all the members who